Knock, knock, knock. Hi, my name is Asoso. I'm going to be your student nurse today. Can I please have your name and date of birth?
My name is Orbosi Bude, and my birthday is September 10th, 1998.
Okay, so I have an order from the doctor to do a chest and lung assessment. This assessment will take approximately 6 minutes and will involve me having to touch your upper body and listen to your lung sounds. Is that okay?
Yeah.
Okay. So this point, I'm going to ask the patient to take his shirt off. All right, so the skin, the skin color is normal for his ethnicity. No lesions, lumps, erythema, cyanosis noted. I am now going to assess the patient's skin. So the skin is warm and dry. His skin turgor is good, returns to place promptly. I'm now going to assess his nails. Nail beds are pink and translucent. The nails are smooth and round, no ridges noted. No evidence of cyanosis noted. There's capillary refill less than 2 seconds on each finger. There's no evidence of clubbing noted. Nail bed angle is about 160 degrees. Okay, so now I'm going to ask the patient to lift his neck up. The trachea is midline, no deviation noted. Okay, now I'm going to palpate the anterior chest wall. Do you feel any tenderness as I'm palpating?
No.
Okay, so no lumps, no masses noted. All right, the patient is breathing about 16 breaths per minute. His breathing is even and unlabored. No retractions noted. I am now going to auscultate the lungs. Okay. Go ahead and breathe in and out. We don't know the relationship that they had, so we don't know what the hell was going on with that. There's a lot of people in my thing that, we want to see everything about the relationship, and we want everybody to post things about relationships, but we don't really know what's going on. We don't know what they are talking about, and we don't know that. It doesn't matter if they had an open talk with everybody at the red table and you were there. When these things happen, you don't know what is the thing that, and the understanding that they had between each other. We weren't there, we weren't there. So all those jokes, it says a lot about one another thing. Okay. So lung sounds are clear on all lung lobes, no adventitious sounds noted. I'm now going to inspect the posterior chest wall. So I'm going to have my patient turn around. Okay, so the skin color on the back of the patient's chest wall is normal with his consistent with his ethnicity. No redness, lesions, erythema, pallor noted. The anterior posterior transverse ratio is 1:2. Okay, so I'm now going to assess for the patient's symmetric expansion. I'm going to place my hands right underneath the ribs, and I'm going to ask him to breathe in and out. Do it again. Okay, so there is symmetric expansion. I'm now going to assess for tactile fremitus. I'm going to place my hands on the patient, and he's going to say the word 99 until I tell him to stop. Okay, go ahead.
99. 99. 99. 99. 99. 99.
Okay, so the vibrations are same throughout. I am now going to palpate the chest wall. Let me know if you have any tenderness. Are you having any tenderness or pain?
No.
Okay, so there's no tenderness upon palpitation, no lumps or masses noted, no erythema, no cyanosis noted.
Okay, so now I'm going to assess the patient for CVA tenderness. I'm going to place my hands on his kidney and I'm going to give it a thump and he's going to let me know if he has any tenderness, okay? Any tenderness?
No.
Any tenderness?
No.
Okay, so there is no CVA tenderness noted. I'm now going to assess the patient's spinous process. Let me know if you feel any tenderness. Any tenderness?
No.
So no tenderness upon palpating the spinous process, and the spinous process is straight. I am now going to do percussions over the lung fields. I'm just going to listen for resonance. Okay. Okay, so there is resonance noted upon percussion. I am now going to auscultate the back of the patient's lungs. I'm going to have the patient breathe in and out. Okay, go ahead, breathe in and out. Okay, so the lung sounds are clear on all lung lobes. No adventition sounds noted. So now I'm going to evaluate the three voice sounds. So I'm going to place my stethoscope on the patient. I'm going to now assess the bronchophony, and I'm going to have him say 99 until I say so. Okay, go ahead and say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. So the sounds are muffled for the bronchophony. I'm now going to assess the egophony, and I'm going to have him say E as I'm auscultating. Okay, go ahead and say E.
E. E. E. E. E. E. E.
Okay, so there are muffled sounds for the egophony, and now I'm going to assess the pectorally, and I'm going to have the patient whisper 1, 2, 3. Okay, so all three voice sounds were all soft and muffled and indistinct. That concludes my assessment. Do you have any questions for me?
No.
Okay, so I'm going to place the bed in low position, place the call light within reach, and I'm going to go document the findings and report it to the doctor.